Well, here's an alarming number. 99% of pediatric beds are now full at one of the nation's top hospitals, Children's National, right here in Washington. And that is mostly because of the respiratory illness known as RSV. That has been surging throughout the country. Well, today we visited the hospital and learned some important information on what parents need to know. Noah and Bailey Wendell didn't know their 2-month-old was sick with RSV until they rushed her to the emergency room.
I was panicked, because I could tell that my daughter was breathing very badly, breathing deep.
The severe respiratory illness invaded Nevaeh's lungs, and she was suffering.
She's definitely a precious little angel.
The family has been in Le Bonheur Children's Hospital in Memphis since Sunday, where Nevaeh is receiving oxygen and fluids. Dr. Sarah Coombs works in the emergency room at Children's National, where she's been treating RSV patients. Are the symptoms more severe this year?
Yes. And that exactly goes to why the hospital is full and why we have so many children needing admission as opposed to being able to be seen and discharged home.
In D.C. and 36 states, RSV cases are rising at an alarming rate as a trio of viruses, COVID, the flu, and RSV, are filling hospitals to capacity. More than 70% of pediatric beds are already occupied nationwide. Why do you think there's been such an outbreak?
So we think it's in large part that during COVID, we had lockdown, we were masking, we were social distancing, and our immune systems, they didn't get the workout they're used to getting.
All three viruses have common symptoms, often starting with a fever, congestion, and runny nose. COVID can cause a sore throat and digestive issues. RSV causes wheezing and coughing. Doctors say if your child is having difficulty breathing, pulling in their chest, flared nostrils, or blue around their nose and mouth, you should seek medical care immediately.
It doesn't matter if it's COVID or flu or RSV. If the child is running into trouble with breathing, it doesn't matter what's causing that trouble with breathing. We need to see them in the emergency department.
In Texas, when the Thompsons saw their 7-month-old baby Miles was lethargic and not eating, they took him to the emergency room.
Don't wait. Don't think it's going to get better on its own.
Well, and Dr. Coombs told us she's concerned about how early this spike of RSV is happening and that it means it could be a long winter for emergency rooms. Now, her advice to parents is remain calm, keep an eye on your child when they're sick, and try and stick with these basic preventative measures like washing your hands.